Hello friends, today we are going to discuss here about permissive hypotension. What does it mean by permissive hypotension? Why this is necessary? So everything we are going to discuss in this video on the point of view of traumatology and surgery. For NEET-SS this is helpful and for NEET-SS helpful. Allowing less than normal blood pressure before definitive control of bleeding has been advocated as a strategy for resuscitation of patient with major bleeding. What does it mean? It means the normal blood pressure is 120 systolic. So your target to make blood pressure below 120. Okay. So hypotensive resuscitation allows for maintaining tissue perfusion. Why this hypotensive resuscitation is necessary? For maintaining tissue perfusion while still maintain integrity of clots and reducing bleeding before a definitive surgical control has been achieved. What is definitive controls? Surgical, you have to go with damage control surgery also. So before any surgical procedure you have to make patient hypotensive resuscitation. This is necessary for maintaining the clots and reducing the bleeding. When blood pressure is low, so pressures in the vessels is low, so there is less leakage of blood. Okay, blood flow is reduced due to hypotension. Permissive hypotension is a bridge. This is a bridge of definitive surgical control. So permissive hypotension act like a bridge in definitive surgical control and not an alternative. Restriction of crystalloid volume also helps by not adding to coagulopathy associated with major trauma. The ATLS 10th edition recommends conventional resuscitation with 1 liter of bolus crystalloids. In adults, you give 1 liter bolus warm crystalloids, but those weight is less than 40, or in children, give 20 ml per kilogram bolus of body weight and does not differentiate between blunt and penetrating injuries. In spite of blunt trauma, in spite of penetrating injury, this protocol is followed. Okay. So if baby weight is 10 kgs, you have to give 200 ml bolus. Okay. The European guidelines for management of major bleeding, on the other hand, recommended a target BP of 80 to 90 mmHg till surgical control has been achieved. So your target to maintain systolic blood pressure around 80 to 90. The concept was initially advocated for penetrating injuries. This concept initially advocated for penetrating injuries, and multiple animal studies and randomized control trials have shown survival benefits in blunt mechanism of injuries too. That's why in starting of video I already explained this protocol is followed for both penetrating and blunt injuries, but firstly introduced for penetrating injuries, then blunt injuries. Through these studies are limited by small sample size and the possible type 2 errors. Also, the concept of hypotensive resuscitation is not applied. This permissive hypotension is not applied, and this is contraindicated in which cases? When there is possibility of head injury too. If there is head injury you suspect, then this protocol is not followed. But why not followed? Let's discuss. To avoid secondary head injuries due to hypotension, if you give permissive hypotension in cases of head injuries or in elderly patients on antihypertensive medications to avoid secondary head injuries. Okay. So hypotensive resuscitation is not allowed in case of head injury. Why? Because this causes secondary head injuries due to hypotension. Which type of hypoperfusion it causes to brain, and it causes hypoxic ischemic changes. Okay, so that's why in head trauma patients do not use permissive hypotension, or in case of elderly patient, those who are on antihypertensive medications. So this protocol is contraindicated in case of head injury, and second in case of elderly patient, those who are on antihypertensive medications. So guys, if you like this series for traumatology and surgery for NISS and NEET-SS, do subscribe this channel. I am going to make individual playlist for this and watch videos here. Thanks.